Good morning from Amsterdam, and thanks for joining my talk in which I will describe how I think we should move towards a better understanding of the physical activity health paradox, and I will do so by presenting a research agenda. My name is Pieter Coenen and I'm from Amsterdam UMC in the Netherlands. The work that I will be presenting today has actually been published already in the BJSM last year, so if you want to know more about the topic, please go to the paper on the BJSM website. As has already been addressed by the previous speakers, what we see in the literature in the last couple of decades is a so-called physical activity paradox. And this physical activity paradox is that with increasing levels of leisure time physical activity, we see a reduced risk of various negative health effects. That is well established and well recognized, particularly in this community. However, we see the opposite, namely increasing risks of negative health effects for those engaging in high-level occupational physical activity. We've done some studies on the topic. Back in 2018, we published a systematic review in which we looked at the association of occupational physical activity and all-cause mortality. And indeed, we found some evidence for the existence of a physical activity paradox. And probably because of that, we were commissioned by the WA Physical Activity Guideline Committee. We were working on the new guidelines that were supposed to be released in 2020. We were commissioned to come up with a report in which we addressed all the health effects of occupational physical activity, and we did so in this paper, which has also been published by now already. You can look it up on the BJSM website as well, but also I will be having a talk about this on Wednesday, so please join my talk on Wednesday if you want to know more about this. So I'm going to talk about this on Wednesday, but very briefly, what we found in this study is from moderate to very low quality, so the quality of the evidence wasn't great. We saw that for some health outcomes, we saw positive health effects for people engaging in high-level occupational physical activity. These are, for example, some cancers or type 2 diabetes. But for others, we found null effects or even increased risks of negative health effects for those engaging in high-level occupational physical activity. This is, for example, for all-cause mortality or for osteoarthritis or sleep quality. And we concluded from this that the positive health effects that we know from leisure time physical activity are not always seen for occupational physical activity. So for us, this was at least some evidence for a physical activity paradox. But like I mentioned, the effect was from moderate quality at best. So there is room for improvement in terms of the quality of the evidence, to say the least. And we were not the only one acknowledging this. Back in 2019, Roy Shepard wrote this editorial based on our work, and he actually posed the question, is there actually a paradox or are there failures in some sort of study methods? And what I will do today is I will address all these points of criticism on the methods that were raised by Roy Shepard, but also by others. And I will eventually end up with a research agenda that can help in the future address these methodological issues. Well, the first issue that was addressed is the evidence base is too limited. It is from certain geographical areas, and I think that's true. Current evidence that we see on the physical activity paradox is mainly from Western countries, and in particular from Northern European countries. And this is an issue, of course. Another issue is that not all health outcomes are properly represented in the full evidence base. However, I think evidence is quickly emerging, so I'm actually not too worried about this issue. I think it will solve itself in the future, because this is just a few examples of literature that we've seen emerging in the last couple of years. This is really in the last couple of years. Cardiovascular responses. This study is on sleep. This study is on chronic diseases. Here's a study on psychological distress. And not just the outcomes are very diverse, but also the samples are diverse. This is an Asian population. This is a study from Helsinki, Finland. This is a study from Japan, and another study from China. So I'm actually not too worried about this issue for the future moving forward. Another issue is the way in which occupational physical activity is assessed. When we look at the literature, we mainly see self-reports being used to assess occupational physical activity, and also we see very heterogeneous definitions. And of course we know that self-reports bear a high risk of inaccuracy or even bias. So that should be addressed in the future. And in terms of heterogeneity, that's an issue too. But maybe that heterogeneity stems from the fact that public health and occupational health researchers have a very different view on how they think physical activity should be approached. And these differences in view are very nicely written down by Andreas Holterman in his article. Here's a snippet of it showing that definitions for occupational activity vary widely, and that's something we should be addressing in the future as well. And of course, what could help here are device-based measurements. Device-based measurements could help us get a better accuracy for our measurements. And also, in this regard, I'm not too worried for the future, because if we look at what's coming out these days in terms of research papers on the topics, we see a lot of really good papers addressing the issue of the physical activity paradox with very good research methods, in particular device-based measurements. Such device-based measurements can then help bridge the gap in terms of heterogeneous definitions. It can provide more detailed information on duration, intensity and frequency of occupational physical activity. It could also help us consider more people's capacity rather than just looking at absolute measures of occupational physical activity. And what it also can do is help us to get more long-term and repetitive measurements, because those are currently lacking in the evidence base. A traditional occupational physical activity study is namely an observational study in which occupational and leisure time physical activity and other relevant factors are measured in some point in time, and then a health outcome is observed at a later point in time. But of course, if we do such a study, then we don't know what happened before the baseline measurement or what happened between the baseline measurement and the outcome. So we need more repetitive or long-term measurements to get a better grasp on what is happening here. In particular, because there is always a risk of so-called healthy worker effect. The healthy worker effect is people with certain diseases moving out of the workforce. So if you measure only in one point in time, you'll typically observe a healthy working sample. And yeah, we need more long-term measurements to get a better grasp on that. When doing observational studies, there is of course also the risk of residual confounding. And this is probably the biggest point of critique on the physical activity paradox evidence. Because we know that when we compare people with high and low levels of occupational physical activity, that they don't just differ in terms of their occupational physical activity, but that there are profound socio-economic differences that lead to differences in, for example, behavioral, sleep and fatigue, financial and work-related factors. To address this and to address residual confounding and for a better understanding of mechanisms, we should therefore properly adjust for confounding and other things like effect modifiers. This may be very obvious to say, but well, unfortunately this is not done properly in the current occupational health literature. But that may not be enough, because we can do confiner adjustments as good as we want, but that may still not be enough to address all residual confounding, and causal inference modeling could help, DAGs could help to better describe pathways, and by doing those kind of things we can better build the evidence base. But we can also think of other research designs. Like I said, most research is based on observational studies, and other research designs such as traditional experimental studies. There are only very few in the occupational health literature. Those could help. But also, if traditional experimental studies are too complicated to do in a workplace setting, we could think of alternative research design. We could, for example, do natural experiments. Based on the previous, we proposed the following research agenda. Findings should be replicated using data from various global regions. I'm actually not too worried about this issue. We already in the last couple of years we've seen a really fast growing evidence base on the topic with evidence coming from various corners around the globe. So yeah, I'm not too worried about this issue. I think we'll get a good evidence base in the near future. Device-based measurements of both occupational and leisure time physical activity should be done. We see this already a lot in the field of public health, but unfortunately not too much in occupational health. I showed you that there are actually quite some really good studies emerging using device-based measurement. So I'm actually confident as well that this topic, this issue will be addressed in the near future as well. Confounding and effect modification should be addressed more extensively, and this is something we should do. Yeah, we can start tomorrow. There's so many good databases just laying around that we can use and can do proper analysis on, and yeah, like I said, we can start doing this tomorrow. So I'm inviting everybody to do so. And lastly, alternative research design should be applied to get a better understanding of causality and also of the mechanisms. And this is something that may take a bit more time, but is really something we should be doing soon, because I think the causality bit and in particular the residual confounding bit is really holding us back at the moment. Of course, I didn't do all this research by myself. There's a great team behind me, and I'd like to acknowledge them all. Thank you very much for your attention.